Thank you very much, Toke and Meredith, for the kind opportunity to participate in this alumni webinar series. And may I begin by thanking you both and Cambridge-INET for organizing this series for us, and also extend my very warm thanks to all our alumni and friends who have very kindly joined us today. We know that the battle for control over the COVID-19 pandemic is an international battle, and the disease has severely affected employment opportunities, economic growth, health, and well-being. And you've heard about some of these effects in previous webinars. To arrest the exponential growth in infection rates, we need to understand the key factors that have led to the rapid diffusion of the disease. And today, I'm going to argue that one important aspect of this is the role of religion. In a recent article examining COVID-19 super spreader events in 28 countries, 9 out of 54 such events were religious gatherings. For over a decade now, I've been working with other economists across the world in developing a new field of research that we call the economics of religion. And the reason that we're interested in this is because there are more than 8 in 10 people worldwide who identify with the religious group. So in this particular figure, from the Pew Research Center's Religious Landscape Study, in America, 36% of Americans say that they attend religious service at least once a week. But more globally, religiosity is also correlated with per capita income across the world. In this particular figure, you have per capita income on the x-axis, the percentage saying that religion is very important to them on the y-axis, and all the little blue dots are various countries. And as you can see, broadly, there is a correlation between religiosity and per capita income. Poor nations tend to be very religious, the wealthy are less so, and the one great exception to this is the little dot on the far right of your screen, the United States, which is both one of the richest countries in the world, as well as one of the most religious. So in our COVID-19 project, we're asking 2 very simple questions. How do religious gatherings and religious networks spread infectious diseases such as COVID-19? And how have COVID-19 induced restrictions on congregations affected physical and mental health? As a part of the team, we have 2 Cambridge Economics PhD alumni, Dr. Girish Behel, who's now an assistant professor in Australia, and Dr. Anand Srivastava, who's an assistant professor in India. So why should religion affect the spread of disease? There has been intense media speculation that the spread of COVID-19 has been reinforced by religious gatherings. In terms of the academic research, though, there's been a paper by Janet Benson in the latest issue of COVID Economics, in which she argues that in times of crisis, people pray. They appeal to faith communities for solace or comfort. And before lockdown, they might even have prioritized the spiritual advantage of attending services over the risks to their physical health. But I would also like to suggest that in times of crisis, people pray, but in times of crisis, people also persecute. If you look at the economic history literature, Johnson and Koyama suggest that there was persecution of Jews in medieval Europe. That was a response to climate shocks. I've done some work with Rohit Tikku and Anand Srivastava that suggests that it's a similar situation in medieval India. And this finding is generalizable across most of the world's religions. So the first hypothesis that we're interested in examining is the increase in religiosity in response to pandemic news, how does this affect the networks that determine the spread of the disease? On the one hand, religious networks might become denser because those who are already religious spend more time with co-religionists, and this increases the chances of infection. On the other hand, people might substitute from activities such as sports and recreation, and that decreases the chance of infection spreading from the religious community to people outside it. We're testing this hypothesis by collecting data across the globe to examine those areas with large and small congregations and how this might correlate with the incidence of COVID-19. We're also exploring differences in the effects of small, frequent gatherings as mandated by certain religions, such as Christianity and Islam, versus larger, infrequent gatherings, such as Hindu religious festivals, to look at how infection might actually spread. Our second hypothesis is looking at the interaction of religion and COVID-19 induced restrictions. How are these actually affecting mental and physical health? Because while religious gatherings may well fuel the rate at which an infection spreads, consequent lockdowns and social distancing measures themselves have effects on religiosity and health. Public health measures we know have restricted all gatherings, and that might have affected religions that mandate regular communal gatherings at places of worship. And this has important consequences for the way people practice religion because they can't be physically present at a place of worship. And sometimes this cannot be easily substituted by electronic means of team communication, although people have tried. So the Royal Choral Society, for example, for the last 144 years, has been singing the Hallelujah chorus from Handel's Messiah on Good Friday. This year, they sang it as well on the 3rd of April 2020, but in isolation. To test our second hypothesis on religion and restrictions, we're currently conducting online surveys in the United States amongst 5,000 people to elicit responses on how COVID-19 restrictions have affected religious practice through family prayers, virtual services, online discussion groups, drive-through prayer and confession, whether this has affected different religions differently, and how disruptions in practicing one's religion have actually affected physical and mental health. But this is really something that I've been thinking about for a long time now, because I've been interested in the effect of religion on mental health. Last year, I published a paper with Jane Fruworth and Anwen Zhang in the Journal of Political Economy, in which we argued that indeed religiosity does affect depression. We looked at 20,000 US adolescents in grades 7 to 12, and we had information on their school and home environment, and we showed that a 1 standard deviation increase in religiosity decreases the probability of being depressed by 11%. We also showed that peer religiosity predicts own religiosity, and that link may be causal. One of the more interesting findings of our paper was that more depressed individuals benefit significantly more from religiosity than the least depressed. We looked at a framework to think about how religiosity might help us deal with depression. Religion provides psychological resources, so might improve self-esteem. Religion provides coping skills, such as ways to approach problems, so it might encourage active rather than passive problem solving. And we know from studies right across the world that religion provides social resources, helpful friendships, neighborhood resources. And in some of the work that I've been doing on the economics of religion in India, we know that organizations there are helping with welfare services and direct financial aid. But we also know that religion reduces exposure to stressors, whether in terms of how to deal with a health matter or a family friend suicide, and that it might foster stable home environments. Again, one of the findings of our paper was that single-parent households were affected more by religion than two-parent households. What we also do is to use the literature from peer effects in economics of education, particularly to show that the link between religion and depression, it may not just be a correlation, but might actually be causal. So we know that adolescent peers have strong effects on a variety of behaviors, ranging from drug and alcohol use to academic performance. And what we argue is that this is true of religiosity as well. When we look across grades in the same school, by chance, students in some grades are exposed to more religious peers than students in other grades. And this creates a quasi-experimental setup for us, because students who by chance are exposed to religious peers may become more religious themselves. We can then isolate the effect of individual religiosity on depression using the variation in individual religiosity that comes solely from this random variation in the religiosity of school grade peers. In plain English, what we're saying is that if certain adolescents become more religious as a result of exposure to religious peers, then we can simply investigate whether these same adolescents subsequently show improved mental health, and that is exactly what we find. So this table gives you an idea of the kind of heterogeneity that we see in religiosity and mental health in our US data. If you are female, you're more likely to be religious and more likely to be depressed. If you're Black rather than white, you're more likely to be religious and you're more likely to be depressed. If you're Catholic, you're more likely to be depressed. If you're from a low-income household, you're more likely to be religious and more likely to be depressed. And if your mother did not have a high school education, you're more likely to be depressed. In our current COVID project, we're using very similar measures for religiosity and mental health that we used in our previous study. So we use for depression self-reported symptoms that are used to diagnose depression in clinical settings. And this is based on a very established scale called the CES-D scale. And it consists of 19 questions which report how frequently people experience different symptoms, and then we aggregate their responses to form the scale. This gives you an idea of the kind of questions that we asked. You were bothered by things that usually don't bother you. You felt that you were just as good as other people. You felt depressed. You felt that you were too tired to do things. You felt hopeful about the future. You felt fearful. You were happy. You felt lonely. People were unfriendly to you. You felt sad. It was hard to get started doing things. You felt life was not worth living. For religiosity, we have measures on the frequency of church attendance, church-related activities, prayer, and the importance of religion. And some of the questions are, in the past 12 months, how often did you attend religious services? How important is religion to you? How often do you pray? And to these traditional questions on religiosity, in our survey, we've now included questions on virtual services, online discussion groups, drive-through prayers and confession, online choirs, and other religious substitutes. Again, we're aggregating them to a scale. For those of you who might be burning to find out how we categorize the multiplicity of religious organizations that exist in the US today, well, if you belong to Assemblies of God or Jehovah's Witnesses, then we would categorize you as conservative Protestant. If you're a Lutheran, we would categorize you as moderate Protestant. If you're a Presbyterian, we would categorize you as a liberal Protestant. If you're Baha'i or Buddhist, Hindu, Muslim, or Jewish, we would categorize you as other religion. And if you're Catholic, well, you're Catholic. So going forward, we have many, many questions to answer. We should have the results from our US survey soon. And if we're able to get further funding for this work, we hope to extend this study to India and Australia as well. We're interested in before lockdowns, was COVID-19 spread by religious gatherings? Now that many places of worship are slowly reopening, some temples in India opened this past Tuesday. On the 15th of June, on Monday, churches, synagogues, temples are all reopening in the UK for private prayer. We're interested in whether face-to-face communication is going to be as important even with social distancing. We're also interested in what happens during lockdowns. Have the COVID-19 restrictions on religion affected mental health? And what are the well-being aspects of these new virtual forms of religious gatherings? Are they going to have the same mental health benefits as physically going to places of worship? Ultimately, and this is the much deeper policy question that we are interested in, if indeed religion matters, as we've shown with some of our previous work, might it or might it not be one potential non-clinical way to complement current mental health policies across the world? Thank you very much for listening.